Acute arterial embolism of the limb. Acute arterial embolism of the limb is a sudden blockage of an artery supplying a limb due to a blood clot, resulting in a lack of blood supply to the limb. This is a life-threatening medical emergency that requires prompt treatment to prevent dangerous complications such as limb amputation, and EV. 1. Vascular trauma. Arterial trauma. This is the most common cause of acute arterial embolism of the limb. This condition often occurs in patients with vascular injuries, particularly when accompanied by a long bone fracture in the limb. Injuries can be caused by traffic accidents, falls, or sharp objects. 1. Vascular trauma. Trauma from procedures on the artery. Procedures such as arterial angiography, cardiac catheterization, and percutaneous transluminal angioplasty can damage the arterial endothelium, leading to blood clot formation and arterial obstruction. 2. Blood clots on atherosclerotic plaques. Atherosclerotic plaques are deposits of cholesterol and other substances that build up on the walls of the arteries. When a plaque is damaged, a blood clot can form on the surface of the ulcer, leading to arterial obstruction. 3. Other risk factors. Cardiovascular disease. Patients with cardiovascular diseases such as atrial fibrillation, heart failure, valvular heart disease, etc. are at higher risk of acute arterial embolism of the limb. 3. Other risk factors. Blood clotting disorders. Inherited or drug-induced blood clotting disorders can also cause acute arterial embolism of the limb. Diabetes. People with diabetes are at an increased risk of atherosclerosis and acute arterial embolism of the limb. 3. Other risk factors. Smoking. Smoking damages the arterial endothelium, increasing the risk of atherosclerosis and acute arterial embolism of the limb. Older age. Older age is a risk factor for many cardiovascular diseases, including acute arterial embolism of the limb. 3. Other risk factors. Obesity. Obesity increases the risk of atherosclerosis and acute arterial embolism of the limb. Symptoms of acute arterial embolism of the limb. Color change in the limb. The skin in the area of the limb with inadequate blood supply becomes pale and may have scattered purple spots due to hemorrhagic necrosis in the area of the tissue lacking blood supply. Symptoms of acute arterial embolism of the limb. Severe pain. Pain usually occurs suddenly and severely in the limb that has been blocked, and may radiate to adjacent areas. Numbness. Patients may experience numbness and tingling in the area of the blocked limb. Initially, this sensation is superficial, but can progress to deep sensory loss. Symptoms of acute arterial embolism of the limb. Cold limb. The area of the limb with the blocked artery is often colder than the unaffected side. Loss of pulse. The pulse sensation in the area of the blocked limb is weak or absent. Muscle weakness. Patients may have difficulty moving the blocked limb due to lack of blood supply to the muscles. Complications of acute arterial embolism of the limb. Limb amputation. If left untreated, prolonged lack of blood supply can lead to tissue necrosis and limb amputation. Heart failure. Lack of blood supply to the heart muscle due to coronary artery embolism can lead to heart failure. Complications of acute arterial embolism of the limb. Death. Acute arterial embolism of the limb is a life-threatening medical emergency, and if left untreated, it can lead to death. Treatment of acute arterial embolism of the limb. Treatment of acute arterial embolism of the limb usually involves thrombolytic therapy. Thrombolytic medications dissolve blood clots, allowing blood to flow through the artery again. Treatment of acute arterial embolism of the limb. Surgery. Surgery may be performed to remove the blood clot, re-establish the blocked blood vessel, or bypass the blocked vessel. Supportive care. Supportive care includes controlling blood pressure, blood sugar levels, lowering cholesterol, and quitting smoking. Note: acute arterial embolism of the limb is a life-threatening medical emergency. If you or a loved one experience any of the above symptoms, you should go to the nearest medical facility for prompt treatment.